have a cracked tooth, or your dentist has told you you have a cracked tooth, what's the best way to proceed? Well, here's what I like to do, and here's a typical treatment process. Number one, the tooth needs a crown on it. So the crown will help support and strengthen the tooth and help reduce the chances of that crack kind of propagating and getting bigger. The tough thing about cracks in teeth is that a lot of times we actually can't even see them. So we're basically just going based off of your symptoms. So step one, crown the tooth, or at least put a temporary on the tooth and see if that temporary eliminates that biting discomfort. If it does, then we have most likely gotten rid of the crack. If you're still having biting discomfort with the temporary or the new crown on it, it could be a sign that that crack is actually a little bit deeper and closer to the nerve of your tooth, and the tooth could then require potentially a root canal. Now, if you get to this stage in the game, you and your dentist should have the discussion of possibly extracting the tooth, because a cracked tooth that has had a crown and a root canal on it has basically a questionable long-term prognosis, meaning it should last, but it's possible that that crack could get bigger and you might end up extracting the tooth. So that's typically kind of how we sequence this in workflow. Obviously, the last option would be to extract the tooth and either leave the space or look at placing like a dental implant. So I hope that makes sense. Number one, crown the tooth, or at least put a provisional on the tooth to see if that eliminates the pain. Number two, you could possibly need a root canal. And again, at that point, the discussion should be had as far as if the tooth should maybe be extracted versus actually doing the root canal. And all of this will just depend on that's the specific tooth and your time and finances and what's important to you. I hope that kind of shines some light on that workflow and that treatment process for cracked teeth. Thanks for your time.